from the heart of the nation's capital. This Week with George Stephanopoulos, live from the museum on Pennsylvania Avenue. Filling in this morning, ABC News senior White House correspondent, Jake Tapper.
Good morning. George Stephanopoulos is taking a well-deserved vacation this week, but no such rest for President Obama, who took to the road with 3 campaign-style town hall meetings to respond to attacks on Democrats' health care plans, such as false claims that legislation in the House creates so-called death panels to deny life or death care to seniors to save money. And last night in Colorado, the president struck a personal note.
I just lost my grandmother last year. I know what it's like to watch somebody you love who's aging deteriorate. So the notion that somehow I ran for public office or members of Congress are in this so that they can go around pulling the plug on grandma? I mean, when you start making arguments like that, that's simply dishonest.
Joining me now from Michigan, the president's top cabinet official in charge of health reform, Secretary of Health and Human Services, Kathleen Sebelius. Secretary Sebelius, thanks for joining us.
Good morning, Jake.
Critics say they're uneasy about end-of-life care measures being discussed within the context of cost cutting. Can you understand that discomfort?
Well, I think end-of-life discussions are very, very personal and very difficult for family members, very difficult often for people to confront. My own mother spent 10 weeks in 3 different hospitals before she died, and I can tell you it was the most agonizing, most painful, most terrible time for not only me and my siblings, but for my dad. And what every family wants is good information and an ability to make a decision that suits their loved one the best way, that the family is involved and engaged. And I think it's really horrific that some opponents of the health reform bill have used this painful personal moment to try and scare people about what is in the bill. Nothing could be further from the truth that there's somehow a death panel. If anything, you know, seniors should welcome the fact that doctors would have a payment provided to sit down with family members if they choose and have a discussion. We were desperate to do that. There were way too many specialists in and out of the room and way too little time to actually sit with someone and try to understand what was going on in my mom's case. And I talked to people each and every day who were having that same difficulty. We wanted to make sure doctors were reimbursed for that very important consultation if family members chose to make it, and instead it's been turned into this scare tactic and probably will be off the table, and that's not good news for the American public and not good news for family members.
Well, that's what I was going to ask, because it's not just opponents who have discomfort about talking about end-of-life care within the context of cost cutting, because the reports are that the Senate Finance Committee is not going to include anything having to do with end-of-life care measures, and that was dropped even before this brouhaha prompted by former Alaska Governor Sarah Palin. The House Democratic bill, of course, does have those provisions. How important is it to the Obama administration that end-of-life care be addressed in health care reform?
Well, again, it isn't about cost cutting. It's really about providing some comfort and opportunity for to empower family members and to empower actually often the patient who is coping with some steps that need to be taken and to make good decisions. What you need is somebody who can sit down with some medical advice, who knows the family, who knows the patient, and have a conversation. And often that doesn't happen, or it's very difficult to have happen. Doctors are too busy, people are rushing out in and out of hospital rooms, you're trying to make decisions. So this was actually to provide reimbursement for that consultation if the family chose to have it. I'm hoping that at the end of the day, that will be part of the overall package, because it's one of the most important conversations a family may ever have. And certainly to try and get some good information, make some decisions, include the patient in those decisions, have a realistic discussion about what's happening and what the next steps might be, I think is so beneficial for family members who often are operating in the dark and very conflicted about what to do next, what's best for their loved one, what's best for the next steps.
So you're hopeful, but if I'm reading you correctly, it's not a deal breaker.
Well, I don't think, again, this is a comprehensive measure that looks at all of our healthcare system, lowering costs for all families, providing good coverage, changing the rules finally for insurance companies so they don't get to pick and choose who in America gets coverage and who doesn't, making sure that the bill doesn't add to our deficit. I mean, those are fundamental principles. I hope this element is part of it because it's something that people talk to me about all the time. And as I say, I've been through it personally with a mother who was very ill at the end of her life, and just having that kind of conversation and consultation, which we finally did, but it was weeks into her hospitalization that the conversation took place. It was very helpful, but it would have been a lot more helpful if it had taken place weeks earlier.
Okay, I'll take that as a yes, and then we'll move on. The president often, and he did last night in Colorado, says to the American people that if they like their doctor, they can keep their doctor. If they like their insurance plan, they can keep their insurance plan. But according to the Congressional Budget Office, if a public plan, if a public option is introduced, at least 2 million Americans will be switched by their employer from a private plan to the public plan. Now, that doesn't get into the whole issue of employers dropping health care coverage in general and all the people that will be added to the rolls, and I understand that. But how can the administration make the promise that if you like your insurance plan, you can keep it, when CBO and other analysts estimate that some people will be switched from private to public?
Well, I think, Jake, if you think about a marketplace option and new plans being created in Toledo, Ohio, or in California or in Florida, the network of doctors is likely to be pretty identical. A lot of plans exist in the same marketplace, and doctors are part of a variety of networks. So the idea that you would keep your own doctor is highly likely. The other thing about the new marketplace is I think the president is eager to stabilize the employer marketplace. Small business owners right now are dropping coverage because they can't any longer afford it. They can't stay in the market. With the new tax incentives that are part of health reform, small business owners would be encouraged to actually stabilize their insurance plans, to offer coverage to their employees. They'd have tax credits, they'd have some help for the low-income employees to be able to afford the coverage. So I think, if anything, it wouldn't dismantle the private market. It would actually help to provide a more stable private marketplace, which right now serves 180 million Americans very well. People like those plans. They want to make sure that if they have employer-based coverage that they like, they can keep it, and this would actually encourage and help employers to stay in the market. On the other hand, if you lose your job, right now you lose your coverage, and the new reform plan would make sure that you had an affordable option even if you lost your job. If you wanted to go out on your own and start your new business, which lots of people want to do, you wouldn't lose your health coverage. So it would have some choices for consumers to make so they wouldn't have the kind of job lock that we see now across America.
Lastly, Secretary Sebelius, and I would be remiss if I didn't bring up that this is back to school season, and there are a lot of parents, including me, who are very anxious about H1N1 and the pandemic that is expected in the U.S. More than 400 Americans have died from H1N1. What should parents do as they send their kids back to school? We know the vaccine won't be ready until October. What steps do they need to take now?
Well, we want every parent to have, at a minimum, a backup child care plan to know if their child gets sick, who's going to be home and take care of that child. What's the alternate caregiver strategy? Because this virus spreads quickly child to child. Schools are taking preparation to get ready with hand sanitizers and frequent hand washing, teaching your children to wash their hands, singing happy birthday to themselves as they wash their hands is good strategy. Coughing into their sleeve, not into their hands, is also a really good strategy because we know that we want to limit the number of germs that spread from child to child. And I think hopefully we will engage schools as good vaccination partners. We anticipate having school-based vaccination clinics as soon as they're available and getting kids the protection that they need. But in the meantime, it's about limiting the spread of the disease, and there's lots of kind of mitigation factors: washing your hands, coughing into your sleeve, staying home when you're sick, at least 24 hours after the fever disappears. The CDC says that's a safe time to send your child back to school, but don't share it with their classmates and playmates.
All right, Secretary Sebelius, thanks so much. We wish you luck with the H1N1, and
Thanks,
we hope
Jake.
for the best there.